Hi there, and welcome to tonight's presentation on Medicare. We call it Making Sense of Medicare because certainly when you get talking about Medicare, there's plenty to not make sense about. And I'm really thrilled to have with me tonight Ellen Good, who is a licensed insurance broker, to help kind of explain the insurance part of Medicare. And then I will talk a little bit about the physical therapy component of it, so that we can kind of piece this all together and provide a lot of information to help you make the best decisions possible. So before we get started, I do want to just take a quick minute to mention that all the information that we're going to present on today is really just for informative purposes. So this is not meant to serve as coverage for Medicare. Certainly, the other thing to keep in mind is that Medicare changes its regulations and rules regularly. So this presentation is timely for the fall of 2021. And certainly if you had questions, we would recommend that you reach out to your local Medicare representative just to get some information that would be pertinent for your location as well as for the time of year that you're viewing this presentation. I am so thrilled to be here with Ellen. For those of you that don't know me, my name is Kristen Wilson. I am a physical therapist and co-owner of Action Potential. We have two locations, one in Glen Mills as well as one in Kennett Square. And we have been thrilled to be offering these informative programs through, since we've opened, which has been 10 years. And then now in a virtual format through the pandemic and after. So this is a really fun opportunity for me to join alongside a fellow colleague, Ellen Good, to be able to share this information. So Ellen, thank you so much for being with me today, and I'll pass it off to you.
All right, great. Thank you. As Kristen said, I am a licensed health and life insurance broker in the state of Pennsylvania, as well as about a half a dozen other states. And primarily, I specialize in Medicare. Medicare is pretty confusing for most people, so I help people understand their options and make the choices that are best for them. And I think I'll just take it from there. Okay, so we're in the midst of open enrollment. It's technically called the annual election period, but most people refer to it as open enrollment. And the dates for that are every year, October 15th to December 7th. There are a number of changes that you can make this time of year. You can change from a Medicare Advantage plan, if you already have one, back to original Medicare, and you can then try to get a supplement or just go with original Medicare. You can change from original Medicare to a Medicare Advantage plan. You can change from one Medicare Advantage plan to another. You can change from a Medicare Advantage plan with or without a drug coverage to another one with or without drug coverage. And for people who already have original Medicare, perhaps with a supplement, they usually have a standalone prescription drug plan, and you can make a change in that would go into effect January 1st of next year. There's another open enrollment period that most people are not aware of. This started in 2019 and it runs from January 1st to March 31st. And this is called the Medicare Advantage open enrollment period. So if you have a Medicare Advantage plan and you would rather have a different Medicare Advantage plan, or you want to go back to original Medicare, you can do that during this period of time. People with original Medicare can't make any changes to either they can't go to a Medicare Advantage plan, and they can't change their drug coverage during this period of time. They also cannot, you can only make one change during this time of year. During the fall open enrollment, you can make as many changes as you want to, and the last change that you make before the end of open enrollment is the one that will go into effect on January 1st. With this open enrollment period, you only get to make one change. So one of the things that makes Medicare really confusing for people is that there's two ways that you can get your Medicare benefits. On the left side, I'll talk through that one first, starting with original Medicare, which is Part A and Part B of Medicare. Part A is hospitalization, Part B is doctors and outpatient services, and this covers about 80% of your medical expenses. So you can continue to use your original Medicare, and then you can purchase a Medicare supplement. And this literally supplements original Medicare. If Medicare doesn't pay for something, your supplement is not going to cover it. And I often use the example of acupuncture. If Medicare doesn't cover acupuncture, your supplement is not going to cover acupuncture. So with a Medicare supplement, you have no network, or another way I can say it is that you can go to any Medicare doctor or hospital in the country, and they will be in your network. So the network is national when you have a Medicare supplement. You don't need referrals to see a specialist. With most of the plans that people purchase, there are no or low co-payments and deductibles. You get an additional 365 days of hospitalization over and above what Medicare pays for. However, there is generally no dental, vision, or hearing coverage, and there's not a fitness benefit. I should clarify on the vision, medical issues with your eyes are covered. It's just, if you get a new pair of glasses, they will not be covered by your Medicare supplement. And then in addition to the Medicare supplement, most people purchase a standalone Part D drug plan, and there's about 30 of those in this area to choose from. So then the trick becomes, getting the right one, and that's something that I generally help my clients with. So the other way that you can get your Medicare is with a Medicare Advantage plan. And this is instead of original Medicare. You continue to pay your Part B premium, but you're not going to be using original Medicare if you get a Medicare Advantage plan. These plans are typically HMOs and PPOs, which we think of as cost sharing plans. You generally have a network of doctors and hospitals that you need to stay within. Most of these networks are local or regional. There are some companies that have national networks, but not all do. You may need a referral to see a specialist. You will have a co-payment for most things. Companies or doctors and facilities are not allowed to charge for certain preventive services that Medicare requires them to cover without a copay. But other than that, if you go to the doctor, if you go to physical therapy, if you go to have a test done, you will probably have a copayment if you have a hospitalization as well. The Medicare Advantage plans do have a maximum out-of-pocket. This year, the maximum for an HMO is $7,550. That's in-network expenses. And if you have a PPO and you go out of network, then your maximum out-of-pocket out-of-network is $11,300. Typically, if you have a PPO and you go out of network, you're going to pay about 40% co-insurance for out-of-network services. These plans can include some fitness, dental, vision, and hearing coverage. You can get these plans either with or without a prescription drug plan. If you happen to be a veteran and you can get your drugs from the VA, you might want to get a plan without a drug plan. Otherwise, most people get them with a drug plan. So how do you decide? This is really, I think, the biggest decision that people make when they first go on Medicare. With the Medicare supplement plans, they are standardized. There's 10 or 12 plans that I'll go into in a second, but each plan has a letter. And if you get a plan F with one company, that plan F is exactly the same at another company. There are no network restrictions as long as the facility accepts Medicare. So if you want to go to Johns Hopkins and they accept Medicare, they will accept your supplement. Premiums will vary. There is a monthly premium, and the premiums vary depending on the plan you choose, your age, your gender, and your location. These premiums usually do go up a little bit each year. I find that expenses are a little more predictable with this approach because basically you pay your monthly premium and then you generally don't have a lot of out-of-pocket costs other than that. You can change from one company or one plan to another anytime during the year, as long as you, in quotes, pass underwriting. And what that means is that after you're past a certain point in time, companies are allowed to look at your medical history and they can decline to cover you depending on what they, find when they look at your medical history. Again, dental, vision, and hearing are not included, and silver sneakers is only included with one Medicare supplement company. With the Medicare Advantage plans, every plan is different. It makes it a little more difficult to compare them because they are all different. And these plans change every year. Companies are allowed to add or subtract benefits annually. There may be network restrictions, or you may pay more to go out of network. If you want to go to Johns Hopkins, I believe they do not take many Medicare, if any, Medicare Advantage plans, so it would be more difficult to do something like that. There are some zero premium plans, including some zero premium PPO plans. Your expenses, I think you'll find, are less predictable because it's kind of a pay-as-you-go model. If you're not using many medical services at first, maybe when you get one of these plans or when you're, in quotes, younger and healthier, you may not have a lot of out-of-pocket expenses. As you get older or as you get sicker, then you may find that you will have more out-of-pocket expenses and you're not going to really know when they're going to hit you. Again, you can get a drug plan if you want one included in your plan. You are locked in from April until December each year. You can get some extras, usually fitness, it's usually silver sneakers, dental, vision, and or hearing coverage. The other thing that's important to know is you may not be able to move to a Medicare supplement if and when you want to, depending on how your health is at that point in time. So just to give you some further comparisons, down the center, I've given some examples. Preventive services are covered the same whether you have original Medicare with a supplement or Medicare Advantage plan. That's required by the Affordable Care Act. For an inpatient hospitalization, that is covered by original Medicare and your supplement with no out-of-pocket cost. I say after Part B deductible, that actually needs to be corrected because it's Part A, it's not Part B. So there's no out-of-pocket for a hospitalization with original Medicare and most supplements. With a Medicare Advantage plan, again, each plan is slightly different. You might pay $175 a day for the first 7 days. You might pay $250 a day for the first 5 days, or you might pay $350 per stay. It will depend on your plan. With Part B chemo drugs, there are some chemo drugs that are administered at the hospital or at some type of outpatient facility. Say you're getting a transfusion of some type, or infusion, I should say, of some type. With original Medicare and a supplement, once you've paid your Part B deductible, it will be covered by original Medicare and your supplement. With a Medicare Advantage plan, Medicare will pay 80%, but you will pay the other 20%. With a skilled nursing facility, if you have to go in for rehab, you have up to 100 days of a benefit. With original Medicare and a supplement, it's covered by Part A and your supplement. With a Medicare Advantage plan, days 1 through 20 are covered. Days 21 through 100 are typically $184 per day this year. For durable medical equipment, that works very much like the skilled nursing facility. With original Medicare and a supplement, it's covered after you pay your Part B deductible. With an Advantage plan, you will pay 20% of the cost. So the reason your decision is important is because when you first enroll in Medicare, you have 6 months where you can get a Medicare supplement plan with no questions asked. In other words, no medical questions asked. But after those first 6 months, they are allowed to ask medical questions. So you can change from one Medicare supplement plan to another at any time during the year, as long as you can medically qualify. So a little bit about the Medicare supplement plans. As I mentioned, I think there's technically like 12 plans, and you see all of them listed here. There are 3 plans that most people consider, and they are F, G, and N. And as you can see under F, you see all the little green check marks, and that's the plan where you have no co-payments and no deductibles for Part A and Part B expenses, so hospitals and doctors and out-of-patient services. With Plan G, everything is covered the same except for the Part B deductible. That deductible this year is $203. It is estimated to be $217 next year. It usually goes up a little bit from one year to the next. Plan N, again, is very similar. You pay the Part B deductible. In addition to that, you pay up to $20 for an office visit. If you go to the emergency room, if you're not admitted, you pay $50. If you are admitted, that is waived. Another thing that's not covered by Plan N is something called Medicare Part B excess charges. In most states, doctors are allowed to charge up to 15% more than Medicare pays them. However, they are not allowed to do that in Pennsylvania, and 95% of doctors, even in states where they can do it, don't. This is called accepting assignment. So if you ever want to ask your doctor if they charge over and above what Medicare will pay them, just ask, do you accept assignment? And if they accept assignment, that means they don't charge Part B excess charges. We found that plans F and G, the rates tend to go up a little faster than other plans because these are what are called guaranteed issue plans. If someone loses their coverage from an employer when they retire or after they retire, they can go to any company in the state and get insurance without any questions asked. However, the companies do not have to offer all of their plans to them. If you turned 65 before January 1st of 2020, you would be put into a Plan F. If you turn 65 on January 1st, 2020 or later, you would be put into Plan G. So what that means is that you have people who are getting into plans F and G without going through underwriting. So they can have any kind of medical problem, and the companies are not allowed to ask or know about it really before they accept them. MACRA is the other little piece of information here, and that is Congress made a change again starting January 1st of 2020, where if you go on Medicare on that date or later, you do not have access to Plan F. The best coverage you can get is Plan G. Congress wanted everybody to have at least a little skin in the game, so they want everybody to at least have to pay that Part B deductible. So that is a fairly recent change as well. And that's what I just talked about there. So plans G and D do not cover that Part B deductible. And so those are the plans that are going to be the best coverage for people who are new to Medicare going forward. Changes due to COVID. Medicare Advantage plans have to cover COVID testing. They can't impose deductibles or copays for testing, and they cannot be subject to prior authorization. They must also cover the vaccine with no cost sharing or prior authorization required. You don't need a doctor's order to get the test or the vaccine, and there has been no 3-day hospital stay requirement prior to entering a nursing home if you have COVID. Physical therapists, occupational therapists, and speech therapists have been allowed to deliver services via telehealth. I'm sure Kristen can talk more to that. There are some people, depending on your income, who will pay a higher surcharge or higher premium for their Part B and Part D plans. So if your income is under $88,000 or under $176,000 if you're married, you pay the standard Part B premium, which is $148.50 this year. I do not know yet what that's going to be next year. If your income is more than that, you can see that your premium will increase. The more money you make, the more your premium is going to be. In addition to that, you will also have a surcharge on your Part D premium, which is your drug plan. So in this case, if your income is higher than that base income, you're going to pay your plan premium plus the surcharge that is listed here, again, depending on your income. And they look back 2 years to your income. So if this is 2021, so they're going to be looking back to 2019. 2022, they'll be looking back to 2020. So the drug plans, I mean, we could spend a whole hour just talking about drug plans. And as I mentioned earlier, this is one of the things that you can change this time of year for effect on January 1st. And I always encourage people to do that because many, many things can change. Your medications, your drug plan can make changes to its formulary. They can make changes to co-payments. And probably the thing that surprises people the most is that sometimes they can be moved automatically from an inexpensive inexpensive drug plan to a very expensive drug plan. And there's a couple of situations where that's happening for next year. So I encourage people to have their drug plan reviewed or to review it themselves by going to Medicare.gov and putting their medications into the plan finder. So that's another important consideration this time of year. Okay, I might have gone too far forward there.
Oh, no problem. I'll take it back one.
Okay.
So certainly, if anyone out there has any questions, whether it's related to the drug plan or other plan specific questions, I would absolutely reach out to Ellen so that she can explain those things to you. Because as you've seen from these previous slides, it is very overwhelming and can be very confusing. So it is important to really align yourself with an expert that can help navigate both the vocabulary, the plans, and all of the other outstanding information to help you make the best decision. Where we fit in as physical therapists is there is a lot of misconception around Medicare and physical therapy and what is covered and what isn't. So I do find it prudent when doing these presentations to really take a moment and just explain kind of what the physical therapy component is in regards to Medicare. Certainly as our bodies age, our need for physical therapy, whether it be for pain or surgery recovery or falls and balance, will become heightened. And I want to make sure that all of our clients, as well as my community members, understand what they have access to through their Medicare benefits. So the first thing I like to just go over is a little bit about the paperwork that you have to complete when you come for physical therapy, because I know a lot of people can say, oh my gosh, it's just so much paperwork every time I go to the doctor, every time I go to the therapist. And the reason this is because there are certain rules and regulations that are set forth by Medicare that we have to be able to comply by to provide ultimate safety and protection for our clients. So obviously the first is a medical consent, saying that you're consenting to being treated. This would be the case at any healthcare facility that you go to, where you are then providing consent for that medical practitioner to provide care and recommendations to you. The second is called a Medicare secondary payer form. Some practices or some facilities will have this and others will not. But essentially this Medicare secondary payer form just essentially tells you or asks questions to make sure that Medicare is indeed your primary insurance company. There are certain times when Medicare can serve as a secondary insurance company. Like for example, if you were in a car accident, then your auto insurance would actually serve as your primary medical benefits and Medicare would serve as your secondary benefits. So our Medicare secondary questionnaire that a lot of physical therapy practices use, and we've actually discontinued ours, just asks, are you receiving Medicare as your primary payer for the correct reason? HIPAA acknowledgement form. I used to say, does everybody know about HIPAA? But by now everybody's heard of HIPAA. This is essentially protection for your health information. Every medical facility has to make you aware of how your medical information is being saved, stored, and transferred. And this is just your acknowledgement to know that you are willing to give your information to that provider who will then safely utilize it as necessary. Therapy threshold notification is a way to notify you that there is a threshold on physical therapy utilization. For 2021, the therapy, we call it the therapy cap, was set at 2110. However, what most people don't know, and we'll talk about this in just a couple of minutes, is that the formal therapy cap was actually repealed in 2018. And what that means is that there is no threshold on your physical therapy benefits or no cap on your physical therapy benefits as long as it's medically necessary. And we'll talk about that in just a minute. Once you reach utilization, or another way of saying that is expenses that total $3,000 for your physical therapy, then you become a high utilization threshold. And essentially what that means is that Medicare is going to be taking a closer look at your case to make sure that we're following all the rules correctly. The last form, and I have an example of this to show you, is called the Advanced Beneficiary Notice of Non-Coverage, and the acronym for that is ABN. This is essentially a document that you would sign if the services that you're receiving from a physical therapist are typically not covered by Medicare. And so the example I use for this one would be if you wanted to come to a physical therapist to do some personal training or some strictly exercise training. This is something that would extend beyond medical necessity. So this would not be a medically necessary service because there are other providers other than physical therapists who can provide that for you, like an athletic trainer or a personal trainer. Because that is a non-covered service, as Ellen mentioned, fitness is not covered. Because it is a non-covered service by traditional Medicare, we could give you an advanced beneficiary notice of non-coverage, which essentially is now saying that we have the ability to charge you cash for that service in the event that Medicare deems it not necessary. So just to give you a little visualization, this is an example of what a Medicare secondary payer questionnaire would look like. It essentially asks you, are you asking for any of these to cover your therapy services, workers' comp, auto, and it asks a variety of different questions just to more or less determine that Medicare is your primary payer. And then this is the advance notice of non-coverage. And this is just saying, okay, in this particular instance, wellness training or personal training is not medically necessary, and therefore the approximate cost of those services would be X. And so it's a way to notify whomever that person is of what the costs of the services would be if you did have to pay for that out of pocket. Okay, so more commonly, what we see is that people are coming to physical therapy for a medical condition, whether it's pain, whether it's surgery, maybe it's falls or balance. And typically, all of those situations are covered as medical necessity because the physical therapist is the provider of choice to remedy all of those situations. So when we look at that definition of skilled therapy or skilled service, Medicare states that that means it's on a level of complexity and sophistication that the patient cannot provide it on their own without the guidance of a qualified therapist. So the real crux of this issue is that it has to be a complex situation that must be guided from a physical therapist. So again, exercise training or fitness training in some situations would be covered by physical therapy if you had something like osteoporosis, or maybe you're rehabilitating from a surgery or have pain. But if you're a fairly well elder and you're looking just to improve your strength or lose some weight, that would be a service that would extend beyond the skilled services of a physical therapist and may not be covered. In some situations it would be, in some situations it wouldn't, and it would be specific to your health and care. Oftentimes in physical therapy, we use tests to help show improvement and to justify that the techniques that we're using are working. So a lot of times, if you've been to physical therapy, you might have had to fill out a survey or do a test to show your progress. And the reason we're doing that is to help declare that this is continuing to be medically necessary and this person is continuing to benefit from the services. Typically, services that are not covered by physical therapy are things like palliative care, which means comfort measures. So for example, if you have a sore neck and you really just want to come in and get your neck massaged, but didn't want to do any of the other things associated with remedying that issue, that would be considered palliative care or comfort measures. We talked about general fitness. And then certainly years ago, maintenance services were not covered by Medicare. However, thanks to a lawsuit in 2011, now, if you have a degenerative or neurological condition, we can use physical therapy to sustain your current activity level to prevent you from declining without physical therapy. Certainly, at the end of the day, the reason that physical therapists tend to be real sticklers about the rules is that oftentimes the decisions about whether something is medically necessary are determined by a Medicare auditor. So if you go to a good physical therapist, you will have these types of conversations with your therapist, and they will explain to you about medical necessity, talk to you about your progress, talk about your plan with you, and help make a fail-safe option so that if under the scrutiny of an auditor, all of your services would be paid. At the end of the day, if a service is not paid, the provider has to give that money back to Medicare and not be paid for any of those services. So the services do not fall on the consumer, but instead that penalty would fall on the provider, and can be very detrimental to a small practice. So a couple common questions that I get all the time in regards to Medicare. And I think it's really important to debunk these myths. And the first one is, do I have unlimited visits with Medicare? So the answer to this is no, but if you have a medical condition, there is no cap on the amount of Medicare that you can receive, or amount of physical therapy you can receive through Medicare. So you can't just come willy-nilly. There has to be a reason why you need that service, and it has to be skilled and medically necessary. And if that is the case, then there is no limit on the number of visits as long as you meet those guidelines. I've had many patients come to me in the past and say to me, oh, my other physical therapist told me that I ran out of visits. And this is actually not ethical for a therapist to do this, because there is no limit on those visits. Oftentimes what we will see is some places will discontinue services if they're reaching that higher audit threshold out of fear for not providing care that meets those guidelines. So I would encourage you, if you are at a facility where that is the case, to look for a different facility. And there are plenty of wonderful physical therapy providers in this area that meet all of the ethical requirements of Medicare. Certainly, we want to make sure that at the end of the day, the skills are, the care is skilled by that therapist, so that we know that it would be covered by Medicare. The next question I get is, do I have to go to the physical therapist that the doctor tells me I have to go to? So for example, if you go to a surgeon and they also own a physical therapy company and they say, we only want you to go see our physical therapist, or I won't do the surgery, or it's best if you go to our physical therapist and that's where I want you to go. That is not ethical, and that is not the case at all. So a doctor cannot tell you that you have to go to a provider, a certain provider. The Medicare beneficiary always has the choice of where they go for their services, as long as the person they choose is a Medicare provider. They can absolutely go anywhere, but it will only be covered by their Medicare if that person is a Medicare provider. So no, absolutely, you can go to any provider that you want to, and for a doctor to tell you that you have to see a certain provider would be against typical ethics. One thing I do like to make people aware of is that in our current joint replacement model, some hospitals and physician practices are incentivized to keep patients within their system because it becomes financially more beneficial for them. I'm not going to go into all of the specific details about this, but just keep in mind that you always have the choice of where you can go to receive your physical therapy care. And then the last question I get constantly is, do I need a referral or a prescription to be able to get physical therapy? The answer to this is a little bit tricky. So the true answer is no. You never need a referral or a prescription to see a physical therapist in all 50 states in this country. So all 50 states have what's known as direct access. And that means that you can go to a provider without a referral or prescription for physical therapy. So you don't need to see your doctor first. You can see in the state of Pennsylvania a physical therapist for up to 30 calendar days without that prescription or referral. Now, here's where it gets a little bit tricky. With Medicare, you can always go to see a physical therapist without a prescription or referral for the first evaluation visit. However, any visits beyond that evaluation must be certified by a physician or a non-physician provider. So what that means is that if you come to see a physical therapist first, and the physical therapist says, hey, listen, I think you need to do a couple sessions, in order for that to be paid for by your Medicare, that plan has to be signed off by some type of a physician or an acceptable provider. So those providers are any type of a physician or a nurse practitioner under the guidance of a physician, a podiatrist, or a dentist. So we work together with our clients to make sure that if they have Medicare, that we can help to communicate with the physician to establish that referral so that there is no disruption in their Medicare coverage. That signature has to be renewed every 90 days. So if you receive physical therapy beyond 90 days, then your physician would have to sign off again. Your physical therapist will work with you and keep you abreast of that situation just so that you're able to meet all of those requirements. So in summary, both kind of combining some tips from Ellen and my presentation, we want to make sure that we're reviewing all of your coverage for Medicare every fall. That way, if there's any changes that you need to make, you're able to do that either during the Medicare open enrollment period or during the Medicare Advantage enrollment period. So make sure that as a good consumer, you're looking at your coverage on a yearly basis, as well as speaking with a insurance representative to help you make the decision that's best for your health and for your budget. And certainly it's important for you to make sure that you are knowledgeable. Certainly we see tons of ads on TV. There's always, mailers, but you want to make sure that you have a knowledgeable person that you can reach out to answer questions and help customize that information for your specific needs. So whether that's Ellen or another insurance broker that you have a relationship with, we do highly recommend that you reach out to someone to help get that information. And then certainly, talk to your local providers and learn the facts. So I encourage my clients to ask me questions about Medicare and their therapy coverage. And I spend a lot of time educating my clients as well as my community through presentations like this so that they are able to understand the language and have access to the correct information. Ellen, I want to first say thank you to you for completing this presentation with me. I know this is a great asset for so many people in our community, so I appreciate you being with me today on this presentation. And then I want to say thank you to anyone watching. And certainly if you have questions, please reach out to either one of us. Both of our emails are located here, as well as both of our websites. If you happen to travel to the Reach Yours website /healthy aging, there is a free downloadable exercise program that I recommend for general wellness for aging. It includes some of my favorite stretches and exercises to help keep the body in top condition as we age. Again, Ellen, thank you so much. And I appreciate everyone's time today and certainly we'll look forward to hearing from you. All right, thank you.
Thanks. Woohoo!
Excellent.